as well as making sure you're getting enough protein in your diet. So the reason that it's hard to lose weight is because nobody's ever taught us how to lose weight. It's not that you're failing at what you're trying to do. And I do want to also dispel the myth that as long as you feel like you look good, it's okay. There is a number, and it goes for African Americans as well as white people, as well as Asians, whatever color you are. You want to be within a normal body mass index. That body mass index is less than 25, even if it's 24.999, you're normal weight. If it's 25 and higher, you're overweight. If it's 25 to 29.99, you're overweight. If it's 30 to 39.99, you're obese. If it's 40 and up, you're morbidly obese, meaning you need to lose over 100 pounds of weight. The reason that is so important is because being overweight and obese increases your risk not only of all of the major killers like heart disease, stroke, kidney disease, but also cancer. I mean, you significantly increase your risk of breast cancer, ovarian cancer, uterine cancer, even cervical cancer, because morbidly obese people are less likely to go see a gynecologist because they're not comfortable with it. So, you know, what I just want to emphasize is that the reason a lot of us have, the reason I failed at weight loss, I mean, I went and saw Curtis right after I had my baby. I had gained over 60 pounds with my baby and was overweight before that. I worked with Curtis and I exercised, but I wasn't eating right. There's a combination that has to be in place. So my little quick 5 tips, and I'll shut up. Sorry, y'all. Have your weight in water. Is what you should be drinking every day. So if you weigh 100 pounds, you need to be drinking at least 50 ounces of water per day. If you weigh 200 pounds, you need 100 ounces of water every day. The easiest and the best way to get your water in is to drink water before you eat. So the proper way to eat is 5 small meals a day, not 1 to 2 large meals a day. With the 5 small meals a day, your first one is breakfast. It breaks the fast. It has to be within an hour of waking up or it's not breakfast. Before each meal, if you do 5 to 10 ounces of water, you start to stretch your stomach. The purpose of stretching your stomach is so that you realize you're satisfied before you overeat. Our goal is never to be full. We just don't want to be hungry. So by drinking water before each of your small meals, you know you're getting it in, and by sipping water between bites, you're going to slow down your eating process, and again, you're not going to overeat because you're going to realize you're satisfied before you overeat. And those are a few of my tips, and I will stop there.
Other questions? Right here.
Jason, as far as having family members that are, what would you say to somebody that you're trying to get counseling? How would you convince somebody who's resistant?
Okay, first thing, convince. The word convince, I already put up boxing gloves. Don't convince me of anything. I want you to expose me. That's why it's really difficult for people to go to counseling, because everyone wants to convince them to go. You crazy, you need to go see somebody. Not telling somebody they're crazy, you need to see somebody. However, let me expose you to some counseling. I know a person. And to recommend it. So it's more of exposing and letting them decide. That's the issue that comes up with mental health, is you need to go see somebody. You need to talk to somebody. You're crazy. Here's a card of a counselor that I know. A lot of times people want to give cards away for counselors, and they need that card themselves. So be aware of your own personal things that's going on before you try to point at someone else. So exposure is one of the most important factors when it comes to counseling. Not convincing, but exposing. The more you know about counseling, the more curious you may become. The more curious you are, you can make a decision, hey, I want to go, or no, I don't think I want to go. So look at exposure when it comes to, hey, my uncle needs some help, expose him or her to counseling. One way to expose them, psychologytoday.com. Write it down. Psychologytoday.com. First, go on that website, find out more information about counseling. It's confidential, it's one-on-one, you don't have to talk to anybody. And also, you can put in your zip code, and you can find counselors, psychologists or psychiatrists within your area that you can look and find more information about them, their services, and schedule an appointment. So exposure is the key. Okay?
And I would even go farther to say that everyone needs a counselor just like everyone needs a primary care doctor. What I tell my patients is everything is about prevention. So you may not be going through something right now, but you may know your family history. And if you look at your family history, the people who are considered crazy now probably weren't crazy 20 years ago. So what I recommend to my patients is I say, you know, one of the best things to do is to be able to go and sit on somebody's couch for an hour who is unbiased. You'll never hear it again. And you get to get stuff off your chest. So even if you're not going through something right then, you want to have a relationship with somebody, because in life, something's going to come up that's going to affect you, whether it's during menopause, whether it's through a divorce, whether it's through the loss of a child, whatever it is. And if you already have relationships in place where you have someone you trust that you can go to, you're going to get through that hard time a lot easier. So it may not be something they need every month, but it may be something you want to do to start building a relationship with a therapist, because we all need therapists.
I'm glad you said a few things about that. One of the most important factors is the myths. First myth, when it comes to counseling, you have to lay on the couch. Myth one, wrong. At my office, you don't have to lay on my couch, you can sit on it. If you don't want to sit on the couch at all, you can stand up, you can lay on the table, you can do whatever you want to do. It's your time, it's your space that you paid for. So you do not have to sit on the couch, lay on the couch, go to sleep, and I'll tell you about your life. That's not the way it works. In counseling, you are the expert of your life, period. I can't tell you what to do, and I'm not going to. Counselors don't provide advice. Myth. Expel. We don't do that, because you're the expert. If I was going to give you advice for every time you had a problem, get ready to have a long relationship with me. I'm gonna meet with you every week, because I'm going to tell you how to run your life. That is not counseling. That's advice. That's what family does. As a counselor, I'm going to help you help yourself. As Mr. Stark said, being uncomfortable, being uncomfortable is the only way to make change. It's uncomfortable to even talk about counseling, even more uncomfortable to go. Another myth, it costs a lot of money. It costs a lot of money to go to a doctor, right? But co-pay, insurance, same process works with counseling. Pay a co-pay. A lot of us don't know that. I don't want to pay over $100 to go talk to somebody. But you may pay $35 for someone to listen. As she mentioned, it's a non-biased opinion, conversation between you and that person who doesn't have a dog in the fight. Where else can you go for 55 minutes and talk about you, uninterrupted? Think about it. And you never hear about it. Alright? So, those are some of the myths. Also, when we look at a counselor, you know, I don't want to talk to this person, how do they know this and that? A lot of that come from this sense of, I don't want to feel that I'm not adequate, I'm not enough, that I can't solve my own problems. We're humans, and the way that we've been able to develop our sense of solving things, of problem solving, is from experience. You learn two ways, what you're taught and what you experience. Some of us have never been taught certain ways to handle things. Some of us haven't had an opportunity to experience certain things. So by going to counseling, you're able to discuss some things that you probably never talked about, never thought about. By bringing this stuff out, it helps you understand, okay, so that's why I'm broke every 2 weeks, but I make over $50,000 a year. Your money skills, that's one way to determine your skills of what you learn and what you experience by your money skills. There's some people out there that make well over 6 figures and broke every 2 weeks. It's a reason behind it. But if you never uncover the reason, you can't fix the problem. Another thing dealing with counseling, I don't want to pay all this money and I'm not going to be fixed. Counselors don't fix people. You can't be fixed. You're not a broke car. Y'all gotta work with me, okay? So the thing is, a lot of people, I don't want to go to this session, I pay this money and I can't be fixed. The problem didn't happen overnight. It's not going to be fixed overnight. Medication is not a one-stop shop. I don't want to be put on medication. Counselors and psychologists typically don't provide medication. Psychiatrists do. You have to know the difference between a psychiatrist and a psychologist and a counselor. Those are 3 different jobs, 3 different people. A lot of us don't know that. So you can go to a counselor and have a conversation, medication never comes up. But we don't know that. So you're not talking to someone who's an expert about you. They're expert on their lives and you're an expert on yours. Does that make a little sense? Just a little bit. Also, the medication piece is another myth that, you know, I feel as though, you know, I don't want to go be put on medication because I'm going to be considered crazy. Medication in mental health is just like medication with physical health. High blood pressure, what do we take? Medication to stabilize. Same thing. I'm having feelings of anxiety whenever I go somewhere. I'm in a crowded space. I'm feeling nervous. Medication helps balance that, but medication alone doesn't do it. It's a combination of medication, counseling, and you making some better choices. So medication is not a fix-it and end-all be-all. The only issue with medication when it comes to mental health is the stigma that's related to it. I'm crazy if I'm taking medication. Half the people who may take medication for diabetes, no one knows about it. Unless you tell them. High blood pressure, nobody knows unless you tell them. You take medication for anxiety, ADD, ADHD, PTSD, no one knows unless you tell them. Same rules apply. Make sense? Alright.
What is
PTSD is post-traumatic stress disorder. But listen. That's another part of mental health and counseling. No, don't talk. Exposure. You have to know what it is. PTSD, typically we hear about it through some of our troops at the VA. This is someone who goes through a traumatic experience. It could be a car wreck. It could be something that's violent, as rape or sexual abuse. And things that happen throughout the day can remind you of that incident. And it causes a lot of stress, anxiety, depression, a variety of things. So we have to at least know about it. Because it's hard to treat something that you don't even know what it is. So that's what PTSD, post-traumatic stress disorder. And you can have that from simple as a dog bite. So you don't have to be in a war to experience PTSD. It could be a car accident. It's the reason you might jump when somebody blow a horn. Or you tell people, hey, don't stand behind me, I don't like that. It's the reason behind it. So we have to find out what may be the root of that reason that we do something that we do. It all starts from one certain place. So a lot of the habits that we have starts from somewhere. It's the reason you're so organized or unorganized. Let's find out why. The most important factor with your mental health is balance. Balance. Another thing dealing with mental health, I don't want to pay this money, it can't be fixed, but we will pay a lot of money to get certain things. For example, with counseling, it's not going to happen overnight, so it may take several sessions. With you, with some of us, hey, I pay a certain amount of money, I'm going to get something. Pay $100, I'm going to get a cell phone, right? We pay power bill, if we don't pay it, we're going to be with lights out. So, for us, it's kind of that instant gratification. I want something that I pay for. With counseling, it's more planting seeds. I want you to think about yourself as an onion. When dealing with counseling, our lives is like an onion. There are several layers. With counseling, one session may take off one layer, but we haven't got to the root. Some people go to counseling one time, hey, I'm good, I'm great, but you just took off one layer of the issue. And more than likely, people who come to counseling for one issue is not the real root of the problem.
I want to touch on a couple of things. I'm glad you said something about pain. And a lot of people, I think, when they make an attempt, an initial step to change their lifestyle, change their habits, it costs. Okay? But you can't look at it that way. You know what I'm saying? Paying for training, paying for Jason, paying for Neil, and Jerry. You have to look at it like you're investing in yourself. You know, so it's like you're investing in your house. You know what I mean? So, because if you don't invest in yourself, you're not going to be there to take care of your kids, see out your grandma, dad, anything like that. So, with that mindset, I encourage people, hey, I'm investing in myself. So it makes it a little better on that. And also, and I love that we're doing this panel. This little thing I got called SPIES. And SPIES, they make the total person. So SPIES is the social, physical, intellectual, emotional, and spiritual part of the person. So that makes the total person. So if you get all those things in order, you should be good. You know what I'm saying? Because what happened throughout your life, you'll start to operate at a higher level. You don't even know it. You know what I mean? You start to think better, start moving better, feeling better, body feel better. You know what I'm saying? So, and it's also a timeline and all this stuff as well. You know, I always tell people when they come in and start to train, hey, it's like, you know, the instant gratification should be you walked in. You know what I'm saying? That's really the biggest step. You know what I'm saying? To kind of admit, hey, something wrong with me, or I need to go see the doctor, or you know, I need to lose weight or whatnot. But it's a timeline, you know, in those first 3 months, you're building a foundation. It's like you get your house, where you're going to build a house, you got to find land, it's a foundation. And then in the next 4 to 10 months, that's when you're going to start seeing some changes. So, patience, I think, is what I'm getting around to. Patience, everything. So, questions?